Then we talk about OR nursing here. I want to skip first one and go to the bottom one. I really like how you described your OR nursing experience here. Delivered evidence-based care to patients in the operating room at a level 1 trauma center. So like you're describing the hospital again to me in the circulator, scrub nurse, and surgical first assistant roles. That tells me a lot about how flexible you are, about the type of work that you did. I would like to know, however, like the types of specialties that you worked on. Like, were you in general surgery? Were you in plastics? Were you on the team that took care of trauma patients? Like, I do want to know, like in one more bullet point, the types of surgeries you were involved in. And I like that you said that you precepted new nurses and served as a resource nurse for robotics. Like you took the time to be a resource to other people. So that's really good. I would love to see that same energy back in like this middle one here. So built rapport and cooperative relationships with surgeons and anesthesia providers. Like it's a little bit of a given. Would rather see you go back to that model that you gave me for the first one. I know it might feel a little bit redundant to you, but again, I want to know about the type of hospital. I like that you told me about the specialties here. That's really, really good. I'd like to know like the different roles that you did. I'd rather be redundant and communicate effectively than to just provide something that's like a little fluffy. You know what I mean? Okay, I'm excited about this page because I feel like we have a lot to dig into here. I love that you're showing off the magna cum laude with both your accelerated second degree nursing program. Accelerated BSN programs are challenging. Being able to keep your grades up, having some sort of a scholarship that like was achievement based. I would love to see you describe what that scholarship is. Like, because you know, scholarships could be needs based, they could be random, or it could be something that you earned. So if it's something that was like an award based scholarship, give me like a one-liner about that. I love that again, you're a magna cum laude in your psychology degree. I love that you mentioned the honor societies that you were in and that you were in 2 of them. That's great. Volunteer experience. I love this one. You went in your current capacity at the time as an OR nurse. So that's great. That shows like involvement in the profession, like a willingness to engage and share your skills other places. So that's really cool. I would like to hear Kenya instead of Africa since it's nice to be more specific. Assisted in performing life-saving gynecologic surgical procedures in maternal care. I would not say for this marginalized community, I would just end it there. You could say assisted in performing life-saving gynecologic surgical procedures in maternal care, such as, and then name like a few key procedures that you helped with. You were also sterilizing surgical instruments. I like that because no job is too small for you. I don't love the last bullet point because for me, it's giving like a little bit of fluff. But just keep in mind, like if you're saying you have a passion for something, like is this going to be your life's work? Is this going to be your life's mission? Like is this something you're going to talk about your essay? Like you're still doing this stuff? You know what I mean? Be careful to avoid sweeping statements or exaggeration. Keep things specific and fact-based.